and welcome. I am Dr. Nadia Hosein, the founder of Crown Her TT, and welcome back to Period Proud. Today we are continuing our period education series, and we have a special guest today, Dr. Nadia Hosein, an obstetrician and gynecologist from the North Central Regional Health Authority, and she's here today to educate us about menstrual charting and managing menstruation. Dr. Hosein, welcome.
Thank you.
Could you tell us about what are some of the ways young girls and young women can manage their menses?
Okay, so each person experiences different symptoms, feelings, and charting of the menses is important. So basically, they could use a calendar. They could actually use something like a period tracker, a diary, or smartphone app such as Flow, My Calendar, Clue.
Great. There are different phases of the menstrual cycle. There is the menstrual phase, there's the follicular phase, ovulation, and the luteal phase. Could you explain what happens to women during those different phases?
Okay, so during menstruations, there are a few effects. Firstly, bodily effects. So the bodily effects would be menstrual cramps, breast tenderness, bloating, and then there's also cognitive changes or changes with the memory, where patients can have difficulty concentrating, decreased alertness, and finally changes to the mood, which would be sadness, irritability, emotional sensitivity, and even mood swings. Now, during the follicular phase, which is right after the menses, the mood tends to be elevated, there's sociability and heightened feelings of attractiveness. For cognition, there's improved verbal skills, communication abilities, and finally, the body actually has increased libido, and sometimes some patients experience ovulation pain. Ovulation occurs after this, and then it is the luteal phase.
What are some of the symptoms? Could you explain during the luteal phase what exactly happens?
So again, we'll go through the body symptoms, and the body symptoms tend to be breast tenderness, bloating, increased fatigue. Cognition would be difficulty concentrating, memory changes, and then with the mood now, there's PMS symptoms or premenstrual symptoms, where the patients could actually feel anxiety, stress, mood swings, or even irritability.
So could you tell us some general information that persons can follow during their period, and when should someone seek medical care?
Okay, so during their period, it's actually advised for them to get lots of fluid, get rest when needed. They could even have like a gentle massage or even use a heat application where it's necessary. Taking pain medication is also common and is allowed. So they must know that there are indications to seek medical care for worrisome symptoms, and that would include excessive pain, despite taking pain medication, heavy bleeding, fainting episodes, vomiting, persistently irregular bleeding, and impaired ability to participate in daily activity.
Great. Thank you, Dr. Hosein, for being here today and for being informative. And as we continue Period Proud, our period education series, and we just dived into menstrual charting and managing menstruation. I am Dr. Nadia Hosein, and we continue more on our series.
Thank you.